So what are the most common complaints I see among patients in their first trimester? So one is morning sickness. So as I said earlier, your favorite perfume, all of a sudden you do not want to be near it. Or your favorite food, if you love chili food or spicy food, you're thinking, no, I can't stand it anymore. So morning sickness is a very common complaint during pregnancy, and you wake up feeling nauseated and you don't want to eat or drink anything, and it's very common. And the higher your beta-HCG levels, meaning depending on the number of pregnancies you're carrying, your symptoms of morning sickness could be worse. So a mother who's carrying twins has higher levels of beta-HCG. Now, beta-HCG is the hormone that we test when you're pregnant compared to a mother carrying one baby. So the higher the levels of beta-HCG, the probability of your morning sickness being worse is there. And normally there are remedies we can give you to counter morning sickness. The other thing is avoid anything that makes you feel nauseous in the morning or any time of the day. Now, there are those who do not get morning sickness. Others will tell you my nausea comes in the evening, or my nausea comes during the day, or if they're exposed to any type of smell that they're not comfortable with, and maybe they were previously comfortable with it. So it depends on what the problem is, and it can be managed with certain remedies that can be given to reduce your morning sickness and assist you to eat. The other common complaint is vomiting. So this is also due to the presence of beta-HCG, which is the pregnancy hormone in your bloodstream. So of course, the higher the number of pregnancies you're carrying, twins, triplets, quadruplets, the higher the beta-HCG levels, and chances are your vomiting and morning sickness will be worse. Now remember, it doesn't occur the same with all women, neither with every pregnancy. So for example, I had a patient who came to me and told me, I'm not having morning sickness and I'm not having any vomiting. So she thought something was wrong with her because her friends told her it's like a must you have morning sickness and vomiting. And actually her pregnancy was uneventful and there was nothing wrong with her. So if you're not vomiting or having morning sickness or nausea, it's absolutely normal. Your scan will tell me you have a baby and everything is going okay. So when does vomiting become a concern for a doctor? Vomiting becomes a concern, especially if it leads to dehydration. You find you can't even swallow your saliva, you can't retain any liquid. So maybe there are foods you may eat and make you vomit. But if you're taking just water or even a fruit juice and you're not able to retain it, and you're vomiting constantly to a point whereby you are dehydrated and you require a hospital admission, and there are certain tests we'll do because dehydration can cause kidney failure. So if we do your kidney function test and liver function test and find they are deranged because you are dehydrated, then that is labeled as hyperemesis gravidarum. And some of these patients may have to be admitted and given fluids through an IV and given medication through IV that will prevent them from vomiting and help them to eat better. The other common condition is UTIs and also candidiasis. So candidiasis, commonly known as thrush. This is a white discharge, and when you come to the clinic, I'll ask you, does it look like maziwa mala? Does it look like curdled milk? It doesn't have a foul smell. It's purely from the vagina, and it's common in pregnancy, and you may experience itching as well. So the other common complaint in pregnancy is UTI. So the female urethra, meaning the passage from the bladder to the outside when a woman is passing urine, is called the urethra, and for women it's very short. Now, when you're pregnant, your immune system takes a little bit of a dip. So small bugs and small infections are going to bug you a little bit. And all these have remedies. So what can you do for UTI? One thing I encourage women is drink a lot of water. So if you know your BMI, I always say at least not less than 2 liters of water a day. And you're not taking them at one go. Throughout the day, 24 hours, make sure you're walking with a bottle. So when my patients come to a clinic, I'm looking for a bottle of water. How else can you prevent UTIs is please do not hold urine. When you feel like passing urine, please go and pass urine. You're a pregnant woman. Most people in public places are going to give you way to go and pass urine. The other important thing is remedies like cranberry juice. Now, there's no medical research that proves that cranberry juice actually prevents urinary tract infections, but many women say they take cranberry juice and actually have relief, and it's okay. The other way you can prevent UTIs and candidiasis is taking probiotic supplements, especially if they are frequent. And there are many in the market that we can prescribe. The other thing is taking yogurt that has probiotics. So if you're going to buy yogurt in the supermarket, look at the ingredients and make sure it's written live cultures. The other one is maziwa mala, anything fermented. And one famous drink in the supermarket is called kefir. Kefir has live cultures and probiotics, and these are known to actually prevent one from getting frequent infections like candidiasis and UTI.
remember to subscribe so that you don't miss out on new content that we release every week.